Today we are going to discuss respiratory medications.
This is presented by Christy Gallardo and Jordan Wilson.
Beta-2 antagonists include albuterol, which is short-acting, and formoterol, which is long-acting. These medications are bronchodilators that relax the airway to dilate the bronchioles, making it easier to breathe. There are two types of beta-2 antagonists, short-acting and long-acting. Short-acting relieves symptoms of acute episodes for those with asthma or COPD exacerbation. Long-acting prevents and treats persistent symptoms for those with COPD. The dose range for albuterol is 2 to 8 milligrams, which is inhaled. It costs around $5 to $60 per inhaler. The dose range for formoterol is 100 per 6 micrograms to 400 per 6 micrograms, which is inhaled or taken by pill form. This costs around $44 to $116 per inhaler or bottle. Side effects for these medications include headache, anxiety, nausea, nervousness, and increased heart rate. Nursing implications would be to monitor for the effectiveness of the medication, treat side effects, and monitor for worsening symptoms. This medication should be taken as prescribed and make sure all medication is inhaled. Get your prescription refilled before running out and keep medication on hand at all times.
Corticosteroids include prednisolone and Tensol and methylprednisolone, which are both short-acting. These medications suppress inflammatory responses and modify the normal immune response. The dose for prednisolone and Tensol is 5 to 60 milligrams per day. This will cost $4 to $12. The dose for methylprednisolone is 160 milligrams per day for 7 days, then 64 milligrams every other day for 1 month by mouth. It also can be given IM and IV. The dose for that is 40 to 250 milligrams every 4 to 6 hours, which costs around $15 to $25. Side effects include hypertension, peptic ulcers, adrenal suppression, hyperglycemia, and thromboembolism. The nursing implications are assess for adrenal insufficiency, monitor input and output, daily weights, and glucose tests. Teach your patient that this medication should be taken as prescribed, that you do not want to stop taking these drugs abruptly. You can take missed doses as soon as remembered. Also, remember to avoid the consumption of grapefruit.
Expectorants include guaifenesin. These medications help mobilize and subsequent expectoration of mucus. The dosage is 200 to 400 milligrams every 4 hours or 600 to 1200 milligrams every 12 hours as extended release products by mouth, and costs around $11 to $40. Side effects include dizziness, nausea, diarrhea, stomach pain, and rash. Nursing implications would be to assess lung sounds frequency, type of cough, and character of bronchial secretions throughout therapy. Also have the patient drink 1,500 to 2,000 milliliters per day to decrease viscosity of sputum. While taking this medication, cough effectively by sitting upright and taking deep breaths before coughing. This medication can cause dizziness, so avoid driving or other activities until you know the response to the medication.